Here in the United States, we're all used to seeing deductibles from private health insurance companies. Medi-Cal has something similar, and it's called Sherive Caught. This is the amount that the participant needs to pay before Medi-Cal will kick in. Basically, it's a required out-of-pocket expense. The main problem is that a Medi-Cal Sherive Caught can wipe out most of your money. This isn't a position we want anyone to be in. In this video, I'm going to share some things that you can do to avoid triggering a Sherive Caught or to reduce your Sherive Caught. Let's dig in. Many disabled individuals all over the United States rely on Medicaid, which in California is called Medi-Cal, for their health insurance. There's quite a few ways you can become eligible for Medi-Cal if you're disabled, but I really want to focus on two ways. The first way is called Federal Poverty Level Medi-Cal, which doesn't have a Sherive Caught. And then the other way is called Medically Needy Medi-Cal, which does have a Sherive Caught. So here's how it works. Your income, that is your modified adjusted gross income, or MAGI, can be up to a certain amount. That amount this year in 2024 is $1,732 a month. So that's kind of the magic number. If your income is lower than that amount, you can qualify for Federal Poverty Level Medi-Cal. But if your income is above that amount, then you're bumped into the medically needy Medi-Cal category, and you do have to pay a Sherive Caught. So why does this matter? Well, essentially, a Sherive Caught is a really high deductible. The government basically allows you to keep only $600 for what they call your maintenance needs. And then you have to spend the rest of the income that you've received that month on Medi-Cal expenses. Only $600 a month to live on? Talk about ridiculous. But I have to share, there's some really good news on the horizon for that horribly low medical needs allowance of only $600. So starting January 1st, 2025, the maintenance need allowance is going to change to 138% of the federal poverty level. And this amount will increase annually. So guess what? That amount right now is $1,732, which is the same as the cap for a Sherive Caught. So very soon, you'll be able to keep the first $1,732 each month of income, and then you only have to pay what's above that towards your Medi-Cal Sherive Caught. That's much more reasonable to me. But what if you don't want to pay any Sherive Caught at all? So let me give you an example. So let's say you receive $2,000 a month in SSDI or child disability benefits. That's over the $1,732 a month of the cap. So now you're bumped into medically needy Sherive Caught. So how much will you pay for Sherive Caught in this example? So for the rest of 2024, you take the gross income of $2,000 and then you subtract the $600 maintenance need and you have a Sherive Caught here of $1,400. That means you're paying over 2/3 of your income towards Medi-Cal expenses. Can you believe it? But starting in 2025, under these numbers, you'll only have to pay $268 a month towards your Medi-Cal Sherive Caught. So that's much better, but it's still not ideal. And this comes up a lot when you have somebody who's been receiving SSI benefits for years. Let's say they're getting, right now in California, you can get up to $1,183 a month of SSI. It's lower in most states, but in California, we bump it up a bit. And so let's say you've been receiving that for years, and that's under the $1,732 cap. And so you're receiving the federal poverty level Medi-Cal, but then your parent retires, and your parent, let's say they get $4,000 a month from Social Security, and you're entitled to child disability benefits of $2,000 a month. And this is under the parent's work record. So I talk about this more in my video, Public Benefits Timeline, and I encourage you to watch that.
Hey everyone, if you like my mom's video, like and subscribe.
So in this case, now all of a sudden, this person's income is bumped over $1,732 a month, and now that's triggering a Sherive Caught. So that's awful. Now, keep in mind, after receiving child disability benefits for about 2 years and 5 months, you start receiving Medicare benefits. So at that point, staying on Medi-Cal may not be as important to you. But there's a lot of things that Medi-Cal and Medicare might cover in different ways. And so it's really helpful to receive both. You can be Medi-Medi, right? You can receive Medi-Cal and Medicare. For example, Medi-Cal is really important if you're receiving in-home support services. And it also does a really good job paying for prescription drugs. And Medi-Cal is the only one that'll pay for a stay at a skilled nursing facility. But even if you plan on just relying on Medicare for your health insurance needs, you still have to wait another over 2 years in order to qualify for Medicare. And you're paying a share of cost during that time. It just doesn't make sense. So let's look at some deductions that could bring you under that cap in this situation. So you can reduce your MAGI, your gross income, so that your net income is below $1,732 a month and you don't have to pay a share of cost. So that sounds good, Ellen. How do you do this? Well, one deduction you can take is for health insurance premiums. So let's say that this person who has, $2,000 a month of child disability benefits, that they pay for Medicare Part B, a premium of, let's say, $168 a month. And they also give you a $20 deduction just because. And then let's also say that they get vision and dental insurance for $100 a month. So that's $288 in deductions. So now your net income is $1,712, which is below the $1,732 limit. So you don't have to pay any share of cost at all, as opposed to the $1,400 share of cost that you'd be paying if you didn't take those deductions. Another type of deduction you can take are just plain healthcare costs. If you have medical bills from a prior month that you haven't paid yet and they're not covered by Medi-Cal, you can submit the unpaid bill to Medi-Cal and take the amount of the bill as a deduction. So what if you just can't bring your income level to below $1,732 a month? Are you out of luck? Well, there's another option if you're able to work even just a little bit, and that's called the 250% Working Disabled Program. In this program, you have to work a little bit. There's no minimum hours working requirement or minimum amount that you have to earn. So you could be caring for somebody's pets or tutoring someone, but you have to provide proof that you're working to your county. And this could just be a note from the person that you're working for. It doesn't necessarily have to be a pay stub. If you're part of this program, here's the really good thing. They don't count your disability income, including SSI, SSDI, and CDB benefits. So if you're in the Working Disabled program, for that prior example where somebody's receiving $2,000 of child disability benefits, none of that $2,000 would count towards your net income, and you don't have to pay share of cost. Now, do keep in mind that if you're receiving in-home support services and then you have a share of cost, you're required to pay that share of cost towards the IHSS provider, and then Medi-Cal will pay the remainder of the IHSS provider's fees. So this is a lot of information about share of cost, but hopefully this video has given you some ideas on how you can reduce or even eliminate your Medi-Cal share of cost. Now, I encourage you next to watch my video, Medi-Cal Updates for 2024, What You Need to Know. Also, I want to invite you to subscribe to my monthly newsletter, where I share all the changes that are happening in public benefits laws and other helpful information. The invitation is in the description box below. Thank you.
Hello everyone. If you liked my mom's video, don't forget to like and subscribe. See you all next time.